Hello, this is Adam Charrington.
And I'm Dan Check.
And we work for KLAS, the healthcare IT research firm, working to give patients a voice in healthcare. This is the Patient Voice Amplified podcast, and we're excited to share with you what we're learning. Dan, we have a very unique guest for today's episode. I know this is someone that has come from an organization near and dear to your family. Kevan Mabbutt, formerly the global head of Insight for the Walt Disney Company, now part of Intermountain Healthcare as the chief marketing and consumer officer. So, Dan, you can ask him all your insider questions about Disney. And
this is perfectly timed. We've got a vacation coming up in a couple of months to Disney World, and I'll be able to get all of the tips and tricks for how to make this a great experience for my family.
And of course, we'll be most interested in what he's helping accomplish at Intermountain. What a unique perspective, someone that has not grown up in healthcare, so to speak, and bringing that outside perspective. So I'm really intrigued what he's going to share with us today. So why don't we jump right in and we'll invite Kevan. Kevan, so glad you're with us.
Thanks, Adam. Great to join you.
We're happy to interview you today and learn about what you're doing at Intermountain and some of your background to help focus on patients. Kevan, can you just share a little bit of your bio for us? Tell us your background and how someone from Disney as the global head of Insight for the Walt Disney Company gets to Intermountain Healthcare. We'd love to hear that story.
Of course, yeah. So, well, firstly, I guess here I am at Intermountain in Utah. I'm not plainly from Utah, as you can guess by my accent. So we've been here as a family in the States since 2005. And during that time, I've worked for Discovery Channel and most recently, as you said, Adam, for Disney. And so my role at Disney was really to help Disney, and this will be the parks, resorts, cruise line part of Disney, really understand what people want and expect of Disney and then help translate that into great experiences. Great experiences in the US, of course, we think about Disneyland and Walt Disney World, but we, during my time there, really understood what it would take to be successful in China and launch the Shanghai Disney Resort. Quite different consumer, quite different experience expectations in China. And then here at home, a lot of my work focused on the digital transformation of part of the experience at Walt Disney World. So, a lot of fun and good times to be had at Disney, but also a lot of pain points. It's a complex and sometimes expensive experience, and people want to maximize their time doing the things they came for. And that meant that we had to really address things like lines and crowds and the sort of transactional elements. And all of that work really resulted in what we call My Disney Experience, which is a digital kind of portal or ecosystem with the magic bands to really take a lot of that friction out of the experience. So you can then, at Walt Disney World, get to do more of what you came for. And actually, Adam, I think as I come into healthcare from Disney, a lot of my focus has been identifying where those pain points and friction exist and how do we mitigate or eliminate those so that, again, the clinical component, the core of what healthcare is about, can be as good an experience as possible, because we've made it easier to navigate and access healthcare, just like you can generally better navigate and access almost anything else in your life, be it travel, Disney, banking. The healthcare experience has just been a lot poorer. So for me, really the incentive, the desire to come into healthcare was really to bring some of those skills and perspective around the consumer and what it takes to drive a great experience to healthcare, which I think is sorely in need of a better experience.
Yeah, thank you for that. And I'm very curious, what parts of consumerism did you anticipate bringing into healthcare? Maybe what did you expect before you started your role, and now that you've been in it for a little while, what are some things you're focusing on?
Well, I mean, a lot of it is at least a parallel process. So I think healthcare over the many years, of course, we've existed as an industry, has gotten very used to delivering its services on our terms. So, we think about the operational and clinical components of what we do, and that's the experience. And we haven't spent anything like enough time understanding what matters to people that we serve beyond just treating them or taking care of their health. So, the process is very similar, Adam. It's about understanding what matters to people and then finding ways to, having anticipated that, deliver on it. And the thing is, you don't get to learn that through traditional healthcare surveys. They're delivered after the fact, very narrow focus, and the experience is very rarely assessed based upon what people want. Different people expect different things from the same experience. So you could have two people visit a clinician on the same day and come away with a very different experience score because the expectation they had was different. One may have been about some level of assurance clinically, one may have been about a warm human encounter, who knows? And so we just have to bring a very different mindset to healthcare, just like more or less any other industry is brought to its space, and spend that time to really understand the consumer beyond the clinical and beyond our own workflows. I think as somebody who's experienced healthcare, we kind of all know many of the pain points. It is hard to navigate. It's hard to get access. The experience is clunky. We tend, since we're quite siloed and focused on the things we do, don't see the experience through the lens of the patient, who has to connect the dots around our org structure, but we don't give them any tools or ways to navigate that. And so a lot of this is about just adopting a very different mindset, doing very different work to understand those needs, and then helping to meet expectations better than we do today. So that, again, the core clinical component of healthcare can shine, be back on a pedestal without all of the friction that gets in the way. Gets in the way both for the provider and the clinician, as well as, of course, for the patient.
That's really interesting. You talk about this Magic Band experience that you had created at Disney. I'm curious, one of the things I love about my Disney experience, I've been to Disney World several times, is I can set my preferences, my rides that I want to be on at a certain time, my credit card information's in there, my family members are all tied to me, and then it creates that frictionless experience that you're talking about. As you have started to survey patients in the healthcare arena and knowing they all have different preferences, do you see a Magic Band type experience that you can create for them where, regardless of preferences, it reduces friction and you have kind of a single point of technology that walks them through this process?
Ideally, yes. And I think, whether, the Magic Band as a form factor really worked for Disney because it has a collectible, personalizable kind of component, and it generates revenue as a kind of piece of merchandise, as well as being a very useful way to help you, as you said, connect your family, express your preferences, and deliver a great experience. Much of what it does can be done, of course, within a cell phone. It's so whatever the form factor might be, I think the same principles apply. So in that case, we knew people would approach a vacation at Walt Disney World with a lot of trepidation, confusion, wanting to get what they wanted to get out of it, but not quite knowing how to do it. So the more you could express preferences up front, guarantee certain things, and then work seamlessly day by day through the experience. So you didn't have to wait in line for an hour for lunch. You already had ordered what you want and you can show up and get it there and then and not waste too much time. That we could know where you are and then maybe even offer you things that we know to be your preferences in the moment to continually optimize your experience. Because however much you plan up front, things will happen during the course of the day that may get ahead of your plans. And the thing about Disney too is people don't want to plan every single aspect. So we needed to enable some spontaneity too. But it really helped us manage people's expectations. And, if you think about healthcare, we don't do a great job of managing people's expectations. So the deal has to be we need to know a little about you to be helpful to you. And I think that trust that healthcare has really lends itself to that kind of an enabler technology wise, just like it does with Disney's trust with its guests. So again, I don't know that we're looking for magic bands specifically. I mean, you think about companies like Royal Caribbean using things like facial recognition to avoid any kind of bureaucracy or paper filling when it comes to boarding a ship and registering. So you can even go beyond the technology of a cell phone or a magic band to really make it completely frictionless, completely seamless. But all of this requires that trust around the data, so that we know enough about you and you're willing to share what can help us help you. Then I think you can create a really great experience that's personalized to that person's preferences, as you say, and actually create sufficiency. A lot of what Disney did with its MBX, the My Disney experience, it helped them sort of manage crowds and load balance the parks. It can help us operationally to know more about what you want and need, and then as we create a better experience for you, we can equally be more efficient on the health system side as well.
You mentioned things like facial recognition, and I know we see that in some industries, like in travel industry, through security lines or entering customs. Some of those things are happening. So it'll be interesting to see what other things you're working on within the health system. Are there examples you'd feel comfortable sharing for our listeners? What are some of the things you're working on at Intermountain?
Well, even just to wind back a little bit, we launched My Health Plus, which is I guess we'd typically call it a digital front door. It goes a lot further than the front door, though, which is our health app. And so with that, we really set out to solve three main pain points how do you find the right care, which is to say clinically the most appropriate care, but also the most affordable care. So symptom checking your way and then online booking into the schedule. Navigating or managing care, again, full of friction, not something you do every day. It's confusing. We make it hard work. So enabling that. And then finally paying for care, which is, again, a pretty rough experience. Nothing like what you get in other industries. So Adam, what we did was we thought, well, who does booking well? Well, airlines do it well. So let's emulate that experience in the app. Who does payment well? Amazon does that well. How do we try to create an Amazon-like experience there? So that's been the principle, is looking outside of healthcare to aspects of our life, whether it's getting a haircut, booking a trip, engaging with your bank, or shopping online, and just finding the best experiences and saying, how can we translate that into healthcare? So that's going to be the principle going on. So a lot of the work we're doing is to continue to work on other parts of the care journey. So how do we begin to deliver care digitally, not just navigate it, but deliver it? How do we help avoid care by keeping you well? So health and wellness is going to be a big component of the app experience too. And then how do we connect that to the in-person experience? So it's a mistake to just focus on something digital like that and then ignore the transition from the digital to the in-person, or the in-person. Every single bit of the experience needs to be optimized. Disney with MDX didn't sit back and say, job done. It really made sure that digital platform was integrated into the in-person so that it became a truly seamless end-to-end experience. That's a big part of the focus. So then that takes you in home and remote monitoring and just ways that we take care of people in the home, and how can we connect you from the home into care, wellness, etc. as well. So there's a lot. We've had a nice start, but there's just so much more to do.
So I'm curious, what are some of the ways that you make sure that the things that you're developing at Intermountain are truly patient-centric? Are you mixing surveys with in-person councils? And I'd just love to understand how you're approaching this to make sure you're truly focusing on the needs of the patient as a consumer.
Yeah, so again, not to not to overly criticize sort of patient surveys, but they really are very limited in what they tell you about people's needs and expectations. Like, you wouldn't step back from those and say, we need a digital front door and it needs to do these things. It would not tell us. So we spend a lot of time, speaking to, listening to, understanding consumers express how the experience goes throughout that journey. Where does it break down? How do you feel when it breaks down? Where is it good? Where are the pain points that we really have to address to transform the experience? So, that can include focus groups, in-depth discussions. More recently, we're getting far more into ethnography, which is to say, really following people through the journey of healthcare, observing, listening, understanding. So surveys have their place, but we're finding some of these qualitative methodologies are actually more insightful to get into the why and the deeper insights around where we can really maximize the experience. So we're not limiting ourselves to surveys by any stretch. And then as we do something like Create My Health Plus, that was really kind of co-created with the consumer. So we understood up front where we should focus. Finding, managing, paying for care, big pain points. But then as we developed, then it becomes like, how are you going to solve that? And that how the development process was very much sort of hand in hand with consumers. Like, as we develop something or prototype something, we would test it and refine it and so on. So we've really tried to involve the consumer at every stage. But again, Dan, we're just starting. Coming from a place like Disney where you obsess about the consumer to a place like healthcare where you simply do not obsess about the consumer, there's a lot of that foundational work we've just got to make part of our daily process. And we're doing that. We've created an insight team. We're doing that work as we speak.
You mentioned a term that we're hearing a lot about. In fact, we're doing a study on it specifically, digital front door, a term a lot of people are using, but can mean several different things. And I think you're giving us a description of what it means to you. But anything you'd add? What does that term mean to you specifically?
Yeah, so it's not a term I'd come across until I came into healthcare. And as I've heard, it expressed coming into healthcare, I think, to your point, it does mean many things. I mean, at its most basic, I guess it means it's a way of accessing healthcare. But in many ways, the real digital front door could be Google. It could be other places. That's not necessarily where the journey starts with a digital front door. For me, it's really about, in this case, a digital platform that can support, nudge your experience from end to end, not just accessing and navigating, having a means of going back and forth with your provider versus having to kind of book appointments all the time, doing televisits, which we enable app, and then a far better, mobile payment experience than traditional way of experience payment and billing. That's all really, really important, but it's not limited to sort of what I think a front door implies, which is access. It's if you really wanted to kind of metaphor from a door, it's, I don't know if it's a house or if it's a street, like it just goes well beyond access in my book. I don't think there's a limit. And I think one of our challenges, we have probably 30 or 40 individual tools within the app already, is how do you continue to sort of build out the scope to make it more robust, more intuitive, more useful without overloading it. What I think we have to avoid is creating lots of front doors, lots of digital touch points. Then you end up with a very fragmented experience. And part of what we're trying to do here is join the dots, connect the experience, know you, be useful to you, support you, enable you at every single stage. So that's how I think about it. I almost never use the digital front door terminology because I think it's really limiting.
That's interesting. We're hearing a lot of the similar things as we talk to executives around the country about the term digital front door specifically. We're down the road from you. A lot of the care that Adam and I receive is from Intermountain facilities, and certainly it's comforting to know someone like you is at the head listening to the consumers and trying to create a great experience for us. As you create this app and this experience for the patients, I assume some of this is self-developed at Intermountain, some of it you're tying into key technology partners. What advice would you give to those that are building and selling the technology to be more patient-centric and create their technology with the patient in mind?
Yeah, excellent question. So, I mean, of course, there's the sort of age-old debate of buy versus build. And, when I joined, we looked around. This did not exist on the shelf. Like, it wasn't like we could just go buy what we needed. We were reticent. We didn't really want to build it either, because, that path can lead to very expensive, quickly obsolete technology. So really how we've approached this is to say, well, look, if we can create a platform that is something that we can kind of grow as we grow, and then the tools or capabilities within it, be it a payment module, be it a symptom checker, scheduling, if we can buy those or license them or kind of adapt or co-create with a vendor or a partner, that's the way to go. So it's kind of a hybrid. We've created the platform because it simply didn't exist, but we're really trying to not build the components. We've already seen, we had a symptom checker we launched with, or actually, sorry, we didn't launch with, but we had piloted with, but then we swapped out for a different symptom checker vendor before we launched. And that's the principle here going forward. We'll always look for that best experience that we can integrate in, so that the platform itself doesn't become obsolete. And we find ourselves in this cul-de-sac where we've spent too much, built too much, and don't know where to go next. So we have, I would say, within the DFD, 12 or 15 vended or licensed solutions as part of the overall experience. No, I'm not presumptuous enough to advise others on that, but I think, it depends on your business and clinical needs and consumer needs as to which way you go. But even today, 3 years on, I still don't think this exists. Definitely not in the way that we needed it for our particular business model, which, really orients a lot towards value-based care. So we've tried to hedge by building what we needed to, but in a minimalistic way, partnering and going down the route of finding solutions that already exist, and then plugging and unplugging them as we go to keep the experience as good as it can be.
So interesting, and we appreciate your perspective on all of these things. So, Kevin, as we wrap up, I'd love to just understand, as you look forward to the future, what are other ways you would like to see healthcare advance to be even more patient-centric? What are you hoping will happen next?
Yeah, I think, even with things like, my health, so these sort of digital front doors, they solve some of the challenges. I think it's great power in data. And I think, where we're going is to increasingly personalize that experience. And that doesn't mean that every single patient experience is unique, because most people have somewhat similar needs. Just as at Disney got really good at mass personalization, I think healthcare can do that too. So personalization is a big part of this going forward. Thinking far more holistically, like we talked about with the digital front door, it has a relatively narrow scope in most people's minds, but why? I think we can really continue to think through the entire journey and support more and more of that digitally. But then you must not forget the impact. It's easy to sort of get, captivated by the technology and forget that you shouldn't just do all you can do. A lot of technology isn't what you should do. So always be guided by the consumer, because their needs should drive what you should do and what's going to kind of gain traction. I think healthcare is just a graveyard full of standalone or point solutions digitally that haven't really gained that traction. So that consumer voice and that kind of focus absolutely needs to be relentless. And then, we often hear in life, don't sweat the small stuff. Well, we do need to sweat the small stuff in healthcare. Some of those, non-technology human moments matter hugely. And that's where someone like Disney's great. They don't just do great technology that enables a better experience. They sweat the small stuff, because the small stuff has big impact on people's perceptions. and frankly, whether they're going to stick with you in a more competitive environment. So, that's something we focus on too, and really try to join every single dot we can to make the experience as great as it can be from end to end. So, it's a combination of sort of continuing to move with technological possibilities, always be kind of relentless around the consumer. And then don't forget the sort of very core of what healthcare is about, which is that human interaction, and make sure that's still at the heart of what we do. And I think as a healthcare system versus a big tech or a retail coming into healthcare, that's that heart, that humanity, I think, is a big part of how health systems can thrive in this new technology and disrupted environment.
Kevin, this has been so interesting and so helpful. Thank you for your time today. We're thrilled to have the chance to have spoken with you. And as Dan said, as patients of Intermountain, we're especially grateful for the work you're doing that's helping us and our families and our classmates here. So thank you for your leadership and the things you're working on.
Yeah, thank you, Adam. Thank you, Dan. Thanks for the opportunity. Thanks for the great work the class does as well. We really value the partnership. And it's been an honor to have a conversation with you today.
Thanks again.
Thank you.
Dan, how about that? What a unique guest, and so interesting to hear Kevin's perspective on healthcare.
Yeah.
What did you learn? What jumped out to you?
I really enjoyed Kevin and his unique perspective. We've talked several times on this podcast about the industry shifting towards more consumer-centric or patient-centric activities and technologies. And Kevin really brought that unique perspective. He did a lot of research when he was at Disney and has continued to do that at Intermountain to find the best way to engage patients or consumers in their care through technology. And it was fun to talk to him about the My Disney Experience app that he helped oversee. I just heard in the news that they're making some more adjustments to that will take even more personalizations from guests at the park and create a guided experience. And what an opportunity to do a similar thing in the healthcare industry and guide the patients through their care journey.
You can see how that would immediately apply, the principles of it, right?
Yeah.
So we've heard of others following that type of path. You might recall when Michael O'Neill from Get Well Network was on an episode, he talked about someone they hired from Marriott that helped with the Bonvoy app. I talked with a provider organization that mentioned, this was Providence St. Joseph. They hired a woman named Shweta Ponapa from Amazon. Same kind of concept, right? And I'm sure there's others following this path. So I think we need to listen for good ideas. I think we need to share those throughout the industry. There are verticals out there that are super focused on the customer and could translate into helping the patient more. So we probably need to hear more of these type of examples to really make a difference.
Yeah, I love when the healthcare industry pulls from best practices from other industries. I've spent several years doing security research here at class, and some of the best security officers from around the country came from the financial industry and other industries that have robust security practices. Very similar trend we're seeing here with organizations bringing in consumer experts.
And we will be among the first to admit healthcare is way different, right? It's not something you can show up and just solve overnight, but there are special ideas out there that can make a difference in this. So
absolutely. So Adam, something interesting that we're starting to hear a lot about is this concept of hospital at home, acute care services done in the home setting. And this is different from a home health environment. This is more acute care services, so post-surgery recovery, things like that. And it's interesting, it's starting to really gain some traction. And the whole idea is let's get the patients as soon as they're able home to where they can recover in the comfort of their own bed. They can be watched over by their family. They can really be the primary drivers in their recovery rather than feeling isolated in a unit in the hospital where maybe they can't have visitors because of COVID restrictions or what have you. So I just think this is interesting. We're starting to do a little bit of research around this topic and trying to understand how organizations are going to approach this and how their remote patient monitoring programs fit into this, what kind of outcomes they're seeing as they engage patients in this new way, and if it really is driving both clinical outcomes and higher patient satisfaction, which we fully assume that will be the case.
That reminds me of how the pandemic is forcing innovation within healthcare, maybe akin to how telehealth was required as COVID spiked. And now that we feel like we're doing a U-turn back into COVID, sadly, maybe it's going to force organizations to test it out. Hey, we've got to do hospital at home, with beds not being available, sadly, and some of those challenges that we're facing as a healthcare industry. Maybe that's what needs to happen. Plans will be accelerated like we saw last year.
Yeah, that scarcity certainly drives innovation. Adam, one of our favorite things about this podcast is we like to end with a quote, something that relates to the topic of the day. What do you have to share with us?
It feels like a theme of the podcast is we really need to listen to patients more. So I've got a quote for you, Dan. There's a gentleman named Doug Larson. I don't know Doug, but I loved this quote, so I thought it applied well. He said, "Wisdom is the reward you get for a lifetime of listening when you'd have preferred to talk." So wisdom truly can come from listening, and hopefully ourselves, our provider friends, our vendor partners, and anyone else listening out there can take that to heart. It's truly part of amplifying the voice of the patient. Let's make sure we listen to them.
Great. Thanks, Adam.
Thanks.
We invite anybody who would like to be a future guest or has an idea for us of somebody that would be helpful for us to talk to, reach out to us at patientengagement@classresearch.com.
Thanks for listening.
We'll see you on a future episode.